Are you okay?
Call 911.
Heart attack, early detection and treatment to reduce dangerous complications. A heart attack, myocardial infarction, is a manifestation of coronary artery disease, CAD, one of the leading causes of death in many countries. Understanding heart attack knowledge is a way to save your own life. When you recognize the signs of a heart attack, calling for emergency medical help immediately is crucial. Master Dr. Tran Hong Nhat, from the Cardiovascular Center at Vinmec Central Park International Hospital, shares his insights to help you better understand heart attacks and post-heart attack recovery. 1. Signs and symptoms of a heart attack. A classic heart attack often happens suddenly and intensely, but sometimes it may start with only a mild pain or discomfort in the chest. Therefore, pay close attention to your body. If you experience any of the heart attack warning signs listed below, you should see a doctor right away for timely treatment. Chest pain, discomfort. Most heart attacks involve discomfort in the center or left side of the chest. The sensation can be a throbbing pain or a tight squeezing pressure, as if a heavy object is on your chest. This chest pain often lasts for a few minutes, disappears, and then returns. It is important to emphasize that not everyone has classic chest pain. The pain may be mild or fleeting, causing people to ignore it or mistake it for symptoms of other conditions, such as bloating, indigestion, or acid reflux. In some cases, especially for those with diabetes, there may be no chest pain at all. To determine if someone is having a heart attack, a combination of symptoms must be considered, not just the severity of chest pain. Discomfort in other areas of the upper body. Chest pain often spreads to other body parts, such as radiating pain down the left arm or both arms, or spreading to the back, neck, or jaw. Accompanying symptoms. In addition to the typical signs above, a heart attack may also occur with the following: shortness of breath, cold sweat, nausea, fatigue, lightheadedness, or dizziness. 2. Causes of heart attack. The causes of heart attack include 2.1. Coronary artery disease, CAD. The coronary arteries are the blood vessels that supply blood to the heart muscle. CAD is a condition where the coronary arteries become blocked by cholesterol plaques, atherosclerosis. Before a heart attack, these plaques can rupture, forming blood clots that obstruct the artery, preventing blood supply to the heart muscle. High-risk individuals include those who smoke cigarettes, have a high-fat diet, I have diabetes, I have high cholesterol, I have high blood pressure, hypertension, are overweight or obese. 2.2. Drug abuse. Stimulants like cocaine, amphetamines, and methamphetamine can narrow the coronary arteries, restrict blood supply to the heart muscle, and trigger heart attacks. Heart attacks due to cocaine use are one of the most common causes of sudden death in young adults. 2.3. Hypoxia, lack of oxygen. In some cases, due to impaired lung function or carbon monoxide, CO poisoning, the heart receives non-oxygenated blood. This prevents the heart muscle from getting the oxygen it needs to function, causing muscle damage and a heart attack. 3. How to manage a heart attack. If you observe signs of a heart attack in yourself or someone else, you must call emergency services, 911 in the US, immediately. It might turn out to be a false alarm, but that is acceptable compared to the tragic potential of losing a life because you didn't call in time. If you are indeed having a heart attack, treatment options depend on whether you are experiencing a myocardial infarction, MI. An MI is the most serious form of heart attack and requires urgent treatment to minimize damage to the heart muscle. The treatment method used will depend on when symptoms started and whether early treatment access is possible. Percutaneous coronary intervention, PCI. This is the first-line treatment choice for MI patients presenting within 12 hours of symptom onset. The narrowed or blocked coronary artery is opened using a balloon, and a device called a stent is usually placed. After PCI, medications like aspirin, clopidogrel, prasugrel, or ticagrelor are necessary to prevent blood clots and re-narrowing. Clot-busting drugs, thrombolytics. For cases where symptoms have appeared within 12 hours but PCI is not immediately available, medications to dissolve blood clots such as redoplase, streptokinase, or urokinase may be administered. If symptoms started more than 12 hours ago, the patient may be offered a different treatment path, especially if symptoms have already improved. The best treatment plan, which could include medication, PCI, or bypass surgery, CABG, will be decided by doctors after the results of an angiogram. 4. Recovery after a heart attack. The recovery process after a heart attack can take several months. This journey requires gradual and steady recovery. Don't rush it. During recovery, Depending on the extent of damage from the heart attack, the patient may need physical therapy or simply a combination of appropriate exercise and a suitable dietary regimen. Recovery typically happens in stages, starting in the hospital and continuing at home after discharge. The two most important goals of the recovery process are gradually restoring the patient's physical fitness to resume normal activities and reducing the risk of another heart attack. 4.1. Exercise. Upon returning home, patients should rest, avoid strenuous physical activities, and only perform light activities, such as walking up and down stairs a few times a day, or walking for a short distance. After a period, the patient can gradually increase their level of activity. 4.2. Appropriate diet. Patients should adopt a balanced diet, reducing refined carbohydrates and fat. Eat plenty of fruits and replace some meat with fish. Substitute butter and cheese with products made from vegetable oils like olive oil. Do not take dietary supplements without consulting your doctor or a specialist. Some supplements, for example beta-carotene, can potentially be harmful. 4.3. Lifestyle. Do not smoke. If you have smoked, you must quit for your own health. Limit or avoid alcohol. Heavy drinking and alcoholic beverages raise blood pressure and cholesterol levels, increasing the risk of another heart attack. Studies have shown that people who continue to drink alcohol after a heart attack have a twofold increased risk of mortality compared to those who do not use alcohol. Weight management. If you are overweight or obese, you should lose weight and maintain a healthy weight by combining exercise with a calorie-controlled diet. Maintain a healthy lifestyle, take medications exactly as prescribed by your doctor, and attend regular health checkups. Monitor your heart condition. If symptoms change, worsen, or new symptoms appear, notify your doctor immediately. Remember, good health comes from maintaining positive habits, a healthy diet, and a good state of energy. If you feel physically unwell, tired, weak, in pain, or have any suspicion of a problem, please contact a medical center or seek out a doctor right away for the best advice and support for your health. Please save this information and share this useful knowledge with everyone around you so they are informed, and together we can spread awareness, join hands, and protect good health for ourselves and our families. What other topics about heart health or stroke prevention are you interested in learning about next?
If you feel physically unwell, please contact a medical center or seek out a doctor right away for the best advice and support. For more helpful tips and in-depth discussions, don't forget to subscribe to Healthy Living Podcasts.